Hello, everybody. Good afternoon, and welcome back to our weekly COVID-19 media briefing with Montgomery County Executive Marc Elrich, also Health Officer Dr. Travis Gales, and Dr. Earl Strutter, who is the Director of the Office of Emergency Management and Homeland Security for Montgomery County Government. I'm Lorna Virgili, Hispanic Public Information Officer, and today, aside from our usual three presenters, we have an additional 4 panelists. We're going to be talking to us, updating you on the multicultural and multilingual outreach the county is currently doing. So we have with us also as well Mariana Serrani with the Latino Health Initiative. Hello, Mariana. Thank you for joining us today. We have Doracine Rosario with the African American Health Project. Hello, Rosario. Rosa Kid, how are you? We have Betty Lamb with the Asian American Health Initiative. Hi, Betty. And last but not least, Ann Hartman, who is the co-lead for the multilingual and multicultural outreach in the county. We are going to be presenting them. Most of them are going to have some opening remarks. Hi, Ken. Good to see you. And after that, of course, we'll transition to the portion of the question and answers of our media briefing. With that, I toss it to you, Mr. County Executive.
So good afternoon again, everybody. This is our weekly briefing that I guess we've been doing now for quite a while, well over a year. I'll start with the case numbers. Our report from yesterday shows there were 110 cases. Our test positivity was 3.25. And our cases per 100,000 were 11.88. There are only 2 counties left in the state that have a lower positivity rate than we do, and only 4 counties that have a lower case per 100,000 than we do. The state's case rate now is close to 23.6. When they hit 25, that'll be the red zone, as a number of jurisdictions in the state are just shy of 25. And there are at least, I think, 3 or 4 jurisdictions that have gone well north of 25, including north of 40. So this continues to be really troubling. But I will say that, again, that what we're doing in Montgomery County and the adherence of residents to the guidance we've provided is probably the number 1 contributor to the fact that our case rates are different than the other case rates. It is not an accident that we're winding up where we're winding up. I want to talk a bit about the J&J pause. I think we all know that the Johnson & Johnson vaccine is paused. From the indications from Dr. Fauci, because this isn't permanent, but they're going to take more time to analyze the data. It's a setback. We were all looking forward to those vaccines adding to the total supply of vaccines so we could get through our populations faster. Pfizer is helping make up for the loss of doses, and we're just hoping that we can move, that we get enough vaccine that we can continue to move quickly. And of course, our concern is that, any bad news on vaccines seems to increase vaccine hesitancy, and we need people to really look at the numbers and look at what people are saying about this, because it continues to be safe, and it's a lot safer to get vaccinated than to get COVID. I got my first dose, and mine was Johnson & Johnson. I got it a few weeks ago. I actually feel fine, and I never had any reaction. I don't think I may not be typical of everybody, but I wasn't even sore. So I guess I got away lucky on that one. The most needed step, though, is the action that the FDA and the CDC did to quickly pause and make sure they were examining any issues of safety with the vaccine. It is absolutely critical that they continue to demonstrate transparency and that they indicate by their actions, not just words, that they're concerned and that they're going to make sure that whatever they do is still consistent with the scientific evidence that's in front of them. This probably won't be the last setback we have in this pandemic. As we know, the doses that we were expecting in the month of March never materialized. at the level we anticipated them materializing. But we're going to continue to do our job and make sure we can work our way through this. We're going to talk a bit about equity today and the vaccine data. This county has made it a point from the very beginning to make sure that we can do an equitable distribution of vaccines, much as we made efforts to make sure we were making testing equitably available to the community. So we have never run on a first come, first served basis. We've tried to make sure that all communities are getting access to vaccines, even if they lack the technology or aren't aware through the normal news media of what's available in the county. So we've done a lot of work to make sure that the message is out to the minority communities in Montgomery County and that we're successfully getting them vaccinated. The good news from this is that we've actually been able to close the gap between white and non-Hispanic residents and Black and Hispanic residents by 15 points for folks 65 and up. When we started, there was a gap of about 20% in the Black and Hispanic community relative to the white community. That gap for Black residents has been reduced to under 5% since the beginning, and it has closed more slowly for Hispanic residents, but it does continue to close. We're doing better than the state averages, both in terms of percent of residents vaccinated by race, ethnicity, and in terms of the gap between white residents and residents of color. In terms of the overall population of 16 plus, we are about 4% above the state average for the white population, 3% above the state average for the Asian Pacific Islander population, 9% for Black residents, and 7% above the average for Hispanic and Latino community. As compared to the state, the gap in vaccination for residents 16 plus, we're at about a 10% gap for Hispanics and whites compared to a 15% gap statewide. And we are 17% between African American and whites, all population, compared to 21 statewide. We are not done. We're going to continue doing this work to make sure we can get those gaps closed. And this has been from the beginning a priority for us. We've shared our information with the state. We've worked with the state to help them develop programs that would enable the state to do a better job of closing that gap. It's good to be asked for your plans from people who are looking for a way to improve their own work. So I'm really proud of the work that our team has done in working at this. And like I said, we're going to continue to stick to trying to do this work and be successful in closing those gaps. And with that, I will turn this over to Dr. Gales.
Good afternoon and happy Thursday to everyone. Always a pleasure to be with you all. I will keep my remarks short and brief so that we can have the space to highlight the work of the different programs. I'm happy to answer any questions. If I am able to, I'm going to share with you some brief slides to just highlight and set the tone of the conversation. As the county executive mentioned, we have been implementing equity strategies from the beginning of the pandemic, and that builds on the extensive work that our community, both in terms of government agencies as well as our community partners, have been doing in the equity space long before COVID came to our doorstep. And we are thankful and excited for the opportunity to have several representatives of different programs to highlight the level, the depth, and the complexity of the work that has been going on throughout the pandemic, as well as specifically as it focuses on vaccine distribution. Before we get to that point, I wanted to just remind folks where we stand in terms of community transmission levels. We're getting lots of questions about reopening strategies and different things like that. And as always, just want to level set where we stand. When you look at here's our first wave of the pandemic, here's our second wave, here's the third wave. And although we have seen improvements, obviously, in increasing percentages of folks getting vaccinated, which is different now than where we were in the first two and even the third, we are creeping up as a state. And our average 7-day average as of yesterday was 23.56, which is just shy of 25, which would meet the criteria of being in the red zone. Montgomery County is at half of that. I think this morning we were at 11.5. We were at 11.8 this morning in terms of our case rate. And so we will continue to monitor these trends and provide guidance as we move forward. Now, to switch over in terms of vaccination rates, the county executive referenced the situation with Johnson & Johnson. As you know from our briefing with council on Tuesday, we have been using Pfizer doses for those first doses across the county apparatus, including the health department doses, as well as the state mass vac site at Germantown. And we will continue to do so with the supply that we have on hand. ACIP met yesterday and determined that they would like to get additional information before providing further guidance and guidelines. So we do not have any further information from the feds or the state in terms of if and when we will be able to use those, the Johnson & Johnson doses again. And just to remind folks that there are 6 cases that are being studied that we know of, none of which have been in Montgomery County or, as far as we know, in the state of Maryland. 6 cases of rare blood clots out of just shy of 7 million doses that have been administered. To pivot very quickly to emphasize what the county executive referenced in terms of our numbers, he spoke very eloquently about the gap that has been closed between Black residents and white residents, as well as we're seeing a decrease as well between Hispanic residents compared to white residents in the county. That's referenced on the graph here on the right side. And here on the left, you see the percentage of those over 65 having been vaccinated, because that's one of the groups that we have moved through and prioritized very heavily. You see over time, the percentages for all racial groups, racial and ethnic categories have increased significantly. And just the last thing I want to emphasize is that when you look at the gap between the percentage vaccinated versus the percentage of those total vaccinated versus the percentage of the population, we're continuing to close those gaps for each of these different groups, particularly Black residents. It's at 7%, it's gone down to 6%, and the same for Hispanic or Latino residents. And when you look on the right side, the 7-day average of doses administered per 10,000 residents, again, is increasing for all racial and ethnic groups, which is a testament to all of the significant work that all of our different community partners, our government agencies, minority health initiatives and programs, and other groups have been working hard to demonstrate. I will stop there and turn the floor over to the representatives of each of those different programs to share with you and highlight some of the great work that they have been doing throughout the pandemic, specifically within the vaccine space. Thank you.
Thank you, Dr. Gales. Thank you, Mr. County Executive. And thank you, reporters, for your patience. We have had some technical difficulties getting started here. We're going to transition to the members of the Multicultural and Multilingual Outreach. Dr. Starter is in the house. He will be ready for the Q&A part of this presentation. And we will get started with some short remarks from each of you. And Mariana Serrani from the Latino Health Initiative is the first one to bring us some update on that outreach. Mariana.
Great, thank you. Good afternoon. Thank you so much for having me. So my name is Mariana Serrani. I am the new program manager for Nuestra Salud y Bienestar, that in English translates to for our health and well-being. So at the worst of the COVID-19 pandemic, the Latino residents of Montgomery County were disproportionately impacted, representing 40% of the positive cases, even though we're only 20% of the population of the county. So these had profound social and economic long-term consequences for the Latino community. So under the commitment and the support of Mr. Marc, Elrich, County Executive, and Council members Gabe Albornoz and Nancy Navarro, in July of 2020, they initiated a special appropriation to fund por Nuestra Salud y Bienestar. So, Por Nuestra Salud y Bienestar is part of the County Latino Health Initiative portfolio, and with the Latino Health Initiative and in the Steering Committee, we are coordinating the effort for the program. Our main goal is to tailor a program to curb the inequalities affecting the Latino community highlighted by COVID-19. The program addresses the diversity of the Latino community by a public health approach that is cultural competent in language and implemented through trusted community-based organization and partners. Con Nuestra Salud y Bienestar offers a comprehensive and integrated approach with our network of community partners. Our clinical partners are Care for Your Health, Proyecto Salud, Mary Center, Caseman Clinic, along with Identity and the Germantown Hub. The unique approach of Con Nuestra Salud y Bienestar is the integration and collaboration of the different components from testing and vaccination to human and social services. So our main service focus on targeting access and reducing inequalities are testing and vaccination, community engagement and outreach, and social and human services. So to date, we have tested almost 75,000 Latinos in Montgomery County in 48 community sites located in high incident, high risk Latino communities in our priority zip code. Those are in Silver Spring, Gettysburg, Montgomery Village, and Germantown. We have administered over 1,500 COVID vaccines since the beginning of March. So these are a mix of first and second dose of COVID vaccines from Pfizer, Moderna, and Johnson & Johnson, and we administer them through our clinical partners and other community partnerships that our clinical partners have been able to establish through the Maryland Equity Task Force. Also, some partners have been receiving vaccines from the federal government and with healthcare providers like Adventist and Holy Cross Hospital. We are also working with our colleagues at the public health to access vaccine for community vaccination events that are hosted at community-based clinics, churches, malls, community centers, and other trusted venues for the Hispanic community. As part of our lessons learned through the testing sites, we are leveraging that infrastructure and using some established relationships that we have with the community to expand them to vaccination clinics. Our goal is to meet the Latino community where they are, to address any hesitancy and foster transparency and trust. The second main focus of our program is to increase knowledge on COVID-19 to mobilize the Latino community around prevention, testing, and treatment. So for these, we have established 3 strategies. We have established a helpline that is 301-270-8432. And the goal of the helpline is to field any calls from the community. So far, we have received 6,800 calls, and we have provided over 8,000 referrals. And the referrals are for a variety of services. It can be for testing, it can be referrals for health services, and also can be referrals for our social component, either cash or rental assistance or food assistance, or to the hubs for any other services that they offer. We're also engaging the helpline to support the Hispanic community to pre-register for Montgomery County information portal for the COVID-19 vaccine. We have so far enrolled over 2,800 Latinos, and we're also registered them for a community clinic events that are supported through our partner and colleagues at Dennis Avenue Public Health. We're also using a very powerful and strategic outreach tool that is the use of our health promoters. We have on average of 50 bilingual health promoters that go out every day of the week, and they conduct face-to-face interventions in high populated Hispanic areas. Those can be apartment complexes, supermarkets, testing events, churches, community centers. And since we have started the program last August, they have reached over 160,000 Latinos, and they have educated over 92,000 Latinos with information and referral services. And we count these by information that has been given to them. So we have a one-on-one personal interaction. That's the reason the work of the health promoter is so impactful, because establish a relationship and a link with the community and with individuals that then can trust us and come to us for the services that we are providing. And we also, the health promoters are also supporting our efforts of pre-registration for the COVID COVID-19 vaccine. Excuse me. We have also have a large 360 Spanish language communication and digital media campaign, and the messages that we are focusing right now is the dual message of vaccination and testing. For this campaign, we have developed a character that is called La Abuelina, and she has a husband named Don Carlos. And La Abuelina and Don Carlos appear in all our materials and in a portfolio of PSAs that we are showcasing in Univision and Telemundo. The same as we have a social media presence in Facebook and in Instagram. We are conducting live Facebook events, and we are having ongoing presence with interviews and community influencers and county spokespersons on television, on radio, and also on Facebook. So far, our campaign has reached over 500,000 people, has had more than 500,000 impressions on Facebook, and over 15,000 impressions on Instagram since it started in October of 2020. And lastly, our very unique component of case management. We think that not only we need to have referrals, and the county has been very generous with the resources that they have provided. Our case management service does the one-on-one link. We work with families and individuals accessing the services. Sometimes they need help because language is a barrier, sometimes they need transportation, sometimes they need connect with the services that are available. It's not enough that services are available, it's important to have the link. So we have worked with our colleagues and Identity. They're one of our partners, and also the German Hub, to provide food distribution, emergency assistance, rental assistance, and any other needs that the families might be encountering at this very difficult time. Thank you.
All right, thank you very much, Marina, for that update as to what the Latino Health Initiative has been doing. Now we're going to toss it to you, Dora Keene Rosario, with the African American Health Project.
Good afternoon, everyone. Thank you so much for the invitation to share the efforts that have been underway within AHAP, the African American Health Program's COVID-19 related efforts. Although the name references African American, it truly is reflective and inclusive of the entire diaspora. So residents within Montgomery County are African, African American, and Caribbean. So similar to the efforts within the previous presentation, culturally competent, culturally responsive outreach and engagement is a cornerstone of this work. Recognizing the special communication needs and the ways in which we have to structure outreach and engagement in a way that's really impactful and really engaged into the residents that we're trying to reach. Similar to the previous effort, we are very thankful for the county executive and county council for sponsoring this effort and making this possible. We are well into implementation. However, the initial months of the response effort was infrastructure building. So we spent some time building the network, recruiting partners, and now we're full steam ahead. So the primary components of the initiative fall within 5 particular categories. However, I would like to take a step back and mention that we do have a principal partner, the National Center for Children and Families. NCCF has been with us from the very beginning, and they play an instrumental role in the management and implementation of this effort, along with the staff of AAHT as well as HHS. So the components of the initiative incorporate testing, So test sites across the county have been scheduled and are working in close coordination with churches, mosques, temples, housing complexes in order to position testing resources within areas that are easy to access and within easy to access either walking, driving, and or public transportation access, as well as from the early data reflective of where we needed to increase our testing capacity within the county. Every resident who comes through one of the AHAP test sites receives a COVID kit. The COVID kits are really comprehensive. It's a mask, a thermometer, hand sanitizer, and a whole host of other goodies that we give to each resident who receives a COVID test at one of our locations. There are huge hits amongst tested residents. And we find that that's a draw in helping folks stay safe and giving them the resources needed to mask up throughout the duration of this pandemic. And it's a tool that we also use to get additional individuals who may be weary about coming in to test, especially in the beginning, to consider coming in and testing with the initiative. A second element of the work is outreach and marketing. So this is an instrumental part of all of the initiatives underway within the county. However, we've set aside a particular pot of money to ensure that marketing reaches to the various venues, social media, businesses that really speak to the Black community and are reflective in imagery and messaging of the needs across the diaspora. Our marketing partners have been really instrumental in helping us get the word out about first testing and now going into vaccination. So we're working really closely with our partners as well as the county executives communications team to ensure that our messaging builds upon the strength of each other's efforts, and we're positioning them in areas that will get a maximum impact within the community. Food security is an additional element of the HAP initiative, so recognizing the economic impact as well as the health impact of COVID, we have incorporated an element within this response effort to ensure that residents who test positive receive an allotment, a 2-week allotment of food to enable them to safely quarantine at home while they are recovering. Within the later months of the initiative, we have expanded that to include residents who come in for testing. So that's an additional draw for folks to come and get tested at the AHAP site. So upon exiting, one brings up the COVID kit, resources, materials, as well as a healthy bag of healthy foods to take with them. The fourth component of the initiative incorporates mental health resources. So this has been a challenge on many fronts, and one of the challenges that we have really tried to focus on is connecting folks to mental health resources within the county. So either within HHS or with some of our mental health partners that are working with the initiative. We recognize the need for this level of support as folks are dealing with the health and economic impact of COVID, and having an outlet to talk about some of those stresses, get some professional assistance, and think about and develop steps to cope and to move forward in a healthy way. The remaining component of the HAP initiative incorporates the Black Physician Partnership. So this is a truly exciting element within the response effort, the BPP for shorthand, is really geared towards connecting folks who may not have a medical home to care. So as we're testing, as we're asking questions amongst the folks that are coming in through some of the test sites, we gently ask questions about medical home capacity or connection to a medical home, and then we're able then to make referrals to individuals who express an interest in engaging with a a Black physician for any follow-up COVID-related needs or needs outside of COVID, beyond COVID, I should say. So there's a small group of physicians that we are currently engaged with that are working with the AHAP initiative to connect folks to care, to do some follow-up work, and to address any pre-existing conditions that may be impacting the individual or household. We are quickly moving into the vaccination space. So this is an exciting element and a new feature within the AHAP response effort. Looking at ways in which to provide in-home vaccination support, because we know that our seniors, our residents who are transportation challenged, and or may have difficulty quickly, getting online and scheduling themselves for vaccination appointment, need this level of support. So within the coming week, this will be an element that the AHAP initiative will be rolling out. So happy to come back and share how that particular element of the project is going. And there is additional conversation to partner with other organizations to be able to stand up smaller community-based vaccination clinics, similar to what has rolled out for testing. So taking the vax to the people, removing the barrier of transportation, and ensuring that there's equitable access, as discussed throughout this entire session, to folks who may not have had access prior to the community-related or the community-based vaccination clinics coming to their particular area of defense. I do want to touch upon the marketing that some folks may be hearing on the radio right now. They're rolling as we speak. So the radio ads are really looking at and have positioned themselves within Black media. So PGC, WTEM, WMMJ Magic, and WHUR are currently rolling advertisements that speak to the need to get tested, the need to pre-register, the need to get vaccinated. I'm encouraging folks to practice public health, continue to practice the public health measures that have been encouraged throughout the pandemic. Keep apart, wear your mask, wash your hands. So all of that remains very much at the forefront of our efforts, ensuring that while folks are waiting to be vaccinated or doing their homework about the various vaccination options available to them, either site-wise and or the actual vaccine that they would like to pursue, we're encouraging folks to get tested and stay safe. That messaging does align with the state messaging, ensuring that folks know about the various places that one can get vaccinated within the county, and the 16 and up age ranges that we're currently vaccinating, and just really supporting the county's efforts across the board to ensure that residents knew about the opportunities within the county. There are also local Comcast commercials that may have been seen by some of the participants here, as well as the use of social media to help reach our younger population who are, very much connected to the social media aspect of connecting in today's society. So in true, diaspora fashion, there's messaging in the languages that reflect the richness of the diaspora. So we work very closely with the Office of Community Partnership, which we'll hear from shortly, to ensure that messages are translated and distributed throughout the various networks. We work with faith-based community as well as the sororities and fraternities to ensure that we're really infused throughout those communities, because we know that they're very influential, and they help us get the messaging out in relation to testing and vaccination. We have 40 plus partners with us, and there is a long list that I could share if folks are interested, but in the interest of time, I'll just share that the partners have been dedicated throughout this effort, and really have stretched themselves to really be within the community and assist us in getting folks to the vac sites, folks to the testing locations, and messaging throughout their respective networks as well. So I will hold if there are any questions, and once again, thank you for this opportunity.
Thank you so very much, Dora Keene Rosario with the African American Health Program. And now we will hear from Betty Lamb with the Asian American Health Initiative. Betty?
Thank you. Thank you for inviting me. My remarks will not be as long as the other two because some of the strategies that we use in the Asian American Pacific Islander community is very similar to what Mariana and Dora Keene spoke about, so I won't repeat those. But at the beginning of the pandemic, the statistics showing the AAPI lower infection rate, lower mortality rate, and now the vaccination rate of 65 plus seems to be proportional to the share of the AAPI population as a whole in the population. So, but this didn't happen by accident. This happened because the community-based organizations have stepped up tremendously in carrying out the work. So the educational outreach, either by virtual or somehow through their more trusted outreach method, has been very successful. So that's why the statistics in the AAPI community has been proportional to their share in the population. There were concerns around not just the infection rate and the positive rate and the vaccination. There were other fallouts from COVID that really impacts the AAPI community. The stigma, the misinformation around the origin of the virus, the tying of the AAPI community to the virus really has created great mental health stress for the community, great economic fallout in the community. But the community-based organizations have stepped up during their outreach to talk about how to preventions and precautions, and the reason for getting vaccination, organizing vaccination clinics. They also, at the same time, connect residents to services, to financial help, to economic help, and to mental health services. So all of the things that Mariana and Dora Keene talked about that impact the Black and the Hispanic community also have the same impact in the Asian American community. And now, on top of that, the stigma attached to the virus, or the misplaced stigma attached to the community, has created great stress. So on the positive note, since March, the HHS Public Health Service area have worked very closely with Pan Asian Clinic to organize vaccination for hard-to-reach population. So just a figure that I wanted to talk about very quickly to indicate the level of work in order to get people to vaccinate. 5,000 calls were made to residents, and as a result, 1,554 people got vaccinated. But 5,000 calls need to be made in order to get that result. So that's kind of the level of work and the level of engagement that these community-based organizations have to do in order to produce this kind of results. So I just wanted to say that, and say that since the beginning, so many testings that were done, food boxes that were given out, and none of those came about by accident. And it was a lot of very intense work from the county government supporting the community-based organization in doing this type of work. So I just wanted to kind of share that and echoed everything that Dora Keene and Mariana said. So that's my comments. Thank you.
Thank you very much, Betty Lamb with the Asian American Health Initiative. And now for the last presentation, we have Ken Hartman, who is the co-lead for the multicultural and multilingual outreach for the county. Ken.
Thank you, Lorna. The county is continuing to use our census complete count committees. Now we call them the COVID community committees. These are 5 committees in 5 parts of the county, which allow us to continue to take a granular approach to our outreach and target specific communities by neighborhood and languages spoken. This is an all-hands-on-deck, volunteer-centered approach. The committees each have a broad representation of people, nonprofits, neighborhood leaders, businesses, and faith communities. The goals of these committees are to promote the vaccine and be a conduit of trusted information to and from the community, and to get people pre-registered through digital and in-person outreach. The in-person outreach has targeted low pre-registration, high-impacted census tracts around the county in Aspen Hill, Wheaton, Fairland, White Oak, Long Branch, Montgomery Village, Twin Brook, Lincoln Park, and Germantown. I have to say the volunteers who have been working with us are the key to our success. In 5 weeks, we have recruited and provided orientation sessions to over 200 volunteers. These volunteers assist us at events in the community with tablets and provide direct pre-registration support to people. That at our events, we use posters and flyers with QR codes that allow people to scan with their phone and go right to the pre-registration website. Our first event was at Mount Calvary Baptist Church in Rockville on March 6th. Leading up to that event, we distributed more than 2,500 flyers to the surrounding neighborhoods. It was a fantastic partnership with the city of Rockville, with the church, with Latino Health Initiative, and our volunteers. Since then, we've held nearly 20 events around the county. Last week at Hughes United Methodist Church in Wheaton, our team pre-registered more than 140 people, about a third of whom spoke Spanish, and there were 28 QR code scans. And there are 20 more events coming in the next few weeks, including events at community grocery stores. The other elements of our effort have included engaging with our trusted nonprofit partners who can provide information and pre-registration support in languages other than English and Spanish. We've translated a lot of material into the top 7 spoken languages. We have improved our digital presence through boosted Facebook campaigns and a new county WhatsApp account in Spanish. And last week we had a very productive meeting with Latin American consulates in the DC area. Happy to take any questions later on in the event. Thank you so much.
Thank you so much to the 4 of you for that update on what the county is doing for that outreach, multicultural and multilingual. Now let's get started with the portion of the Q&A, and I am sorry to say that we have a 1:20 p.m. hard stop, which means that by 1:20 this afternoon, we need to cut this presentation. And let's get started with the first question. Jordan Lindsay from my MCM has a question for Dr. Gales. Jordan?
Great. Thank you so much for hosting this. I just wanted to know, when it comes back to the J&J vaccine, you guys mentioned that the Pfizer will help replace that. What are you going to do with all those old J&J vaccines? Are they going in the trash? How will this impact the current vaccine process? Will it make it much slower? And it's paused, so when it comes back, or if they do bring the J&J vaccine back, how will you guys implement this into the community where there's trust?
Thank you, Jordan, for your question. I think the larger overarching framework within which to answer those questions is still to be determined, in large part based upon what guidance we will receive from the FDA and CDC in terms of how to move forward. And so I would be hesitant to answer that question in more specific details about our strategies, because that will be in large part dependent upon the guidance we receive from the federal level and the state level in terms of how those doses can and will be used if they are, permitted in the future. Now, for the first part of the question, interestingly, this happened at an interesting time because last week we also received word, due to issues with manufacturing of the Johnson & Johnson doses, that we would see a decrease in the allotment of doses we received. And even preceding this week's announcement about the case review, the doses that were provided to us at the MassVac site, as well as the local health department allocations, were significantly and primarily Pfizer doses. So we did not actually have a ton of doses sitting around left from last week's supply. And the doses that we do have, we are continuing to store. One of the advantages of the Johnson & Johnson doses compared to the other ones that may have more significant cold chain storage is that they can be stored and the shelf life is of a longer duration. So as long as, our ability to use those doses will be contingent upon, one, getting approval pending the review by ACIP and FDA and CDC, as well as the potential time frame within which that decision is made.
Thank you.
Thank you, Dr. Gales. Thank you, Lindsay. Jordan, next question comes from Kate Ryan, WTOP. Kate.
Thank you. I have a bunch of questions, but one, the impact of the Johnson & Johnson news within the communities that have just spoken to us, if you could overall address that. Is there one common thread, and are people truly, reluctant now because of that news, or are they getting the message that, as you say, 6 out of nearly 7 million reactions that are under study right now? So how much of a concern is that people are being put off by it? Question about graduation, do we have guidance on that yet? And I'm getting from the community questions about community pools and regulations that are not clear, that they're conflicting with CDC guidance. If you can address those. I'm sorry, I know it's a lot, but I figured I'd take my shot when I could.
All right, I guess I can start and do this rapid fire, and then everybody else jump in or where. So the pool's guidance has been clarified, and that information will be provided with those in the community. Our licensing and regulatory services team has reviewed those again, and we'll be providing further information on that. And I believe we also addressed that at length in our council briefing on Tuesday. So please stay tuned. Similarly, the graduation guidance will be forthcoming. In fact, earlier today, we've been going back and forth to provide edits to potential Board of Health resolution that could be introduced in the very near future. And that guidance will be provided to public schools as well as non-public schools. So that is very much in the works, and we hope to have that released in the very near future. As your first question related to the impact of hesitancy and so forth, I think it's still very early and too early to determine the impact of that. I think for many folks who may have been hesitant about the vaccine or have had questions about it, this may be like, aha, see, I told you so. Here is some facts to do it. To justify that. At the same time, I think it's incumbent upon us as public health officials to make sure that we are doing our due diligence in getting out high quality information to the community so that they can make informed decisions. In large part, that is making sure that we break down and explain to folks exactly what's happening when we're talking about clot formation and those kind of things. I think it's very important to take the time to explain that to our residents so that they can understand why there is concern. I think also important within that process is to emphasize that to the point that you made, out of 6.8 million doses administered, including to our own county executive, these cases were reported in 6 instances. And as it stands today, there has been no causal relationship linked between those instances and the vaccine, which is why the ACIP, the Committee for Immunization Practices, is gathering more information to determine exactly what happened and if there's a causal relationship. No, undoubtedly, we do know that this is going to cause alarm and make folks nervous, including those who've already been vaccinated, as well as those who are in the queue to get vaccinated in the future. And I just want to emphasize is that we will continue, as we find out more information, to translate that in ways within which our residents can easily understand and hopefully address the questions that they may have.
And just while we have these people who have their boots on the ground and their hands around the problem directly, when they talk to people who are reluctant, what's the message that works to get someone to go, I guess I will take the shot?
And who would like to answer that from the 4 panelists that we brought in today?
I was going to say that at the various engagement that have been successful in the AAPI community is that we oftentimes get the authoritative figures to do like speaking engagement, town hall, webinars, and if they look at physicians speaking about it, scientists, and usually that works. That's the level of engagement that works because they hear from these figures talking about it, explaining about it. So in the past, that worked for us. So perhaps we have to double the effort around this. Figures that they trust, that they believe in, speaking in the language that they understand so that they know, and being very transparent about it. Especially sharing their own experience of being vaccinated.
Does that answer your question, Kate?
Oh, Doreen was about to say something, and I know time is short, so I don't want to capitalize.
Just to piggyback on what Betty shared, that is absolutely true. And using community residents, local influencers to share the message, especially any personal history that they have or any apprehension that they may have had in the beginning, and then, the thought process that went into making that decision to vaccinate, and now, post-vaccination, sharing how they're doing, how they're feeling, and how they feel post-vaccination is also quite impactful. So co-signing everything that Betty shared, and as well as ensuring that we have community residents that you're likely to run in, as you're running your errands and going about your daily life, as well as local trusted figures that will assist in getting the message across.
Thank you so much.
I'd like to add one piece to that, actually. And so we've been working with some behavioral health scientists to help us understand as well. And one of the big key things that they've talked to us about is that different people are motivated by different reasons for wanting to do something or not wanting to do something. And so there's really not going to be a single message that's going to be effective for every single person. And there will be nuance and differences between people, even within different populations, and so not everyone thinks the same. And so having multiple messages that speak to a multitude of different, whether it be science-based concerns, it could be fears of government, it could be religious. There's a whole plethora of different rationales, and you can't just use one message. One message does not solve all of the issues, and you have to have a plethora of different messages that address different concerns.
Thank you, Kate.
Thank you.
Thank you. The next question comes from Corey Smith, NBC4, and I believe he has questions for you, Dr. Stoddard, as well as Dr. Gales. Corey.
Hi, thank you, and also have a kind of a follow-up to Kate's question. Sorry to continue to harp on the J&J delay. The comments that Dr. Gales made echo the comments made by his colleague in Prince George's County. They've got enough of Moderna and Pfizer to handle this on a short-term basis. But at what point would you start getting concerned about a prolonged delay if this thing goes for 2 weeks, 4 weeks? And how would a prolonged delay impact efforts to expand the distribution of the vaccination, i.e. mobile vaccination sites and churches? And how would it impact the ongoing equity efforts? Obviously, in a hard-to-reach community, it's easier to vaccinate somebody once rather than to have to go out there twice.
Thank you, Corey, for your questions. I think at the core of all of this is, if we take a step back, is that the impact of the Johnson & Johnson situation most significantly impacts the capacity of doses that we have available. And that has been an issue that we have continued to work through since the beginning stages of vaccine distribution. So certainly as the quantity supplied remains low or diminished, that hampers our ability to be able to move through quickly and provide opportunities for the general public and specifically for different communities where a one-shot vaccine is more preferable due to whatever issues in terms of being able to follow up for a second shot. So the lack of supply and large-scale supply does continue to hamstring our ability to get good penetration in general, but particularly in other communities where we have been prioritizing to get those doses into arms. Now, the longer-term consequences of that is that it extends the time frame within which we will be able to achieve those higher levels of protection and higher percentage of our residents getting vaccines, which will allow us to feel more comfortable, particularly in the setting of variant strains that have been demonstrated to have become the predominant strains of COVID, that are more contagious and easier to spread than the novel strain at earlier stages. And it gives us it extends that time frame, if you will, in terms of being able to achieve those goals where we have achieved a higher percentage of those with protection. Now, I think that in many ways, the Johnson & Johnson doses were going to provide a good window within that. For example, there are millions of doses that were produced that were lost. Of the 15 million doses that were lost due to manufacturing issues did cause us to get a reduction in our allotment of doses across the board this week. And so certainly to offset that, we'll have to continue to see an increase in doses, both from a Pfizer and Moderna perspective, to be able to offset those particular losses.
Any events been canceled because stemming directly from the delay that was announced recently? Mobile vaccinations, anything like that?
For us as the county site, we pivoted to utilizing the Pfizer doses to help support the mass vac site at Germantown, and the overwhelming majority of the doses that we were using as a part of the health department projects, both in terms of with our community partners, were with utilizing Pfizer doses, which are the doses that we've received. I can say that some of the federal and state strike teams that were going to come into communities and provide some of those mobile services were primarily using or planning to use Johnson & Johnson doses. And as a result of that pause, some of those efforts have been temporarily postponed until further notice.
Perfect. Thank you so much. And then one really quick question for the community agencies. Are you all considering or thinking about any language to address the J&J vaccine specifically? As Dr. Stoddard said, there's a number of different messages that have to get through on vaccine hesitancy itself. Are you all thinking about ways to really kind of get the community educated on what this really means and the fact that it is 6 people among nearly 7 million doses distributed?
Sure, I can go first. Yes, we are engaging social media and also through interviews, aligning with the talking points, the information that the county is putting forward to express to the community, and we probably will develop some content, flyers and stuff like that we can share at different events. Our main source of support for this is also the word to mouth that the promotoras are doing at the community. So we're all aligning with the same message that, this is temporary, and we will follow the best guidance to provide safe vaccination for everyone.
Are you good, Corey?
Thank you so much. I appreciate it. Thank you all. Have a good day.
Okay, thank you so much. Next is Dominique Monesi from WAMU. Question for Dr. Gales.
Hi, Dr. Gale and Dr. Stoddard. I think it's for both of them. I want to go back to the data, specifically looking at page 15 of 20 of the equity framework you guys sent us. I just want to understand, first, how did you get that gap to narrow by 5%? You mentioned that it was at 20%, you can see from the chart, and then, we're seeing that it went down about 5% for both Hispanics and African Americans, more for African Americans than Hispanics. And how does that compare with the state's efforts? Because I know that the state also has put forward their own efforts to invest in equity, and just wondering sort of how that compares. Oh, and then, sorry, let me just get both of my questions out here on the same thing. Also, there still seems to be a gap. There's still an 8% gap with African Americans and about a 13% gap with Hispanics. Are you declaring victory already? Is this, are you saying this is, I'm just sort of wondering why you're presenting this to us now.
I'd be happy to take a first stab at it. I don't think any of us are declaring victory upon this because it's the numbers that you mentioned show us that we still have tremendous work to do. And the reason why, I can't speak for everyone else, but I would speculate the reason why we have had the groups present today is to, one, share with you all of the work that has gone into the efforts to get that number down from 20% to less than 5% and 8% for the Latino community, particularly given that in the last several weeks when we've talked about equity at the state level, it's been intimated from the state level that local health departments and communities are lagging behind what the state is doing, and that's just not true. The depth and comprehensiveness of all of the programs that you've heard today speaks to the level of commitment that we have as a county, not just now, but that has been demonstrated throughout the pandemic, and not only just in the pandemic, but has been demonstrated through the continual efforts that the county has undertaken in that space that predated COVID last February and early March. So no, we're not celebrating and we're not saying mission accomplished. We're just highlighting the tremendous work that has gone in with not only the county agencies, but also the tremendous partnerships with our community partners to get that number down to where you see today. And we know that the gap that you mentioned that has closed speaks to those over 65. And I would also like to say one of the other things that has driven that is the effort that the county undertook in the early stages of vaccination to ensure that there was an equitable distribution and allocation of doses based upon priority zip codes, as well as making sure that there was extra consideration given to those who live in communities and represent communities that have been hit hardest by COVID so far. And we implemented that strategy in the early stages of the vaccine distribution process, and we were excited to see the state adopt some of those very similar policies as they moved forward and worked to stand up equitable allocation and principles in the statewide distribution. And when we look at the data, whereas you've highlighted some of the continual gaps that we have here, the gaps have also been closed by the enforced efforts to get folks pre-registered into our systems to make sure that we have reach and access there. And I believe if I looked at the data correctly, the state has, of all of the folks, the collective pool of individuals who've been fully vaccinated, I think it's approximately 1.4 million people across the state of Maryland. 20% of those are Black residents and 4.5% are identified as Hispanic. So in looking in comparison to the state, there's still some significant areas that we need to see in terms of more representation of different communities. And again, when we look at our local level, the graph that we presented that showed that we have 12% of the total of those who have been fully vaccinated are Black compared to 18% making up 18% of our population. So there's still a gap we've got to fix there. And then when we look at our Latino residents, 12% of those who've been fully vaccinated are Latino in comparison to 19% of the population.
Did that answer your question, Dominique?
Thank you.
Okay. Next is Aisha Khan, Fox 5 DC, with also a couple questions. Aisha.
Hi. Okay, so I'm going to go back to probably the J&J topic. So with that pause with the vaccines, do you think you still have enough of the other vaccines to meet demand if, let's say, you do move to the phase where everyone will be vaccinated in the same way that President Biden is set to announce on Monday that all adults will be eligible beginning April 19th. Second, do you plan to have more walk-up vaccines available, or do you feel that there could be a vaccine fatigue? So Dr. Gale, is that question for you or Dr. Starter?
Thank you, Aisha, for the questions. I'll start to throw some ideas out there. I think right now, it's less about vaccine fatigue and there's still vaccine hunger. We have a lot of people who are still very interested in getting vaccinated, and we don't have enough doses to supply that. And so while I think that we all would love to be able to provide vaccines to every living resident of our jurisdiction, the state, and the country, we just simply don't have the doses to be able to meet that demand right now. And so we will continue to get out all of the doses that we have and exhaust them, because if we exhaust them, that means we've gotten shots into arms of many more people, and we will continue to devise new strategies to be able to increase that outreach, as evidenced by the community partnerships we have here that have been discussed in terms of being able to support the stand-up efforts within the community to increase that footprint. But yeah, I think the thing to remind folks at home is that even though, yes, we're saying that everyone is eligible, that doesn't mean everyone will be able to get an appointment right away, because again, unfortunately, we're dealing with a limited supply.
So I just want to chime in. I'm very frustrated when people continue to tell everybody that they're eligible when there's no real change in the supply of vaccine. No one's going to get any vaccinated any faster, whether you declare that everybody's eligible on the 19th or on the 17th or on the 21st. It all depends on doses. And unless the supply of doses increases, the total number of people will get vaccinated at the exact same rate. For the county, if we, between the MassVac site and theoretically how many doses we have, if I've got 50,000 doses, no matter who you declare eligible, 50,000 people will get vaccinated. And it's frustrating because every time you tell people they're eligible, they think that means they can go sign up and get a vaccine. And that's not going to be the case. They are still going to have to wait. As Dr. Gale said, this is a supply problem. And if we had more supply, we'd vaccinate more people. It would speed up the line. But just declaring that you can get in line doesn't mean you're actually going to get vaccinated. And I hope, that those of you who report on this emphasize to people that just because somebody told you were eligible doesn't change the fact that the supply is far less than the demand right now. And so you're going to have to wait, because people's expectations keep getting unrealistic, and that causes unnecessary frustration.
In furtherance of what the county executive said, we still have 142,000 people in our pre-registration list who have not gotten vaccinated yet. We still have 70,000 or 68,000 or so people in the state's pre-registration list who are looking to use the Germantown site. We have never had a situation where we could not fill a clinic with people who have raised their hands, who are eligible, who fall into the categories that we're currently vaccinating. And so we do know that there will be a switch that occurs at some point. We just don't know when that's going to be. We just know it's not now, and we've got a lengthy list of people still that want to get vaccinated over the coming 2, 3, 4 weeks. In a month from now, maybe things shift, and then we're trying to really go find people to be vaccinated in terms of, we don't have enough people to fill the clinics, as some other jurisdictions, even in the state of Maryland, have experienced in filling out the MassVac sites in Hagerstown and Eastern Shore, where they have a little bit more of a challenge filling the spots. We're not seeing that in Montgomery County yet. We still have plenty of residents who are beating down the door to get vaccinated. Our goals in making it more accessible and into communities are not driven by a lack of people who are interested in receiving it, but a desire to make sure that we're being equitable and providing fair and equitable access to people who may be challenged in getting to some of the larger sites that we operate.
Thank you, gentlemen. Thank you, Aisha. We have about 5 minutes or so left. 1:20, hard stop. And the last questions come from Rebecca Tan from the Washington Post. Rebecca.
Thank you so much, everyone, for being here. For all the panelists, as well as for Dr. Gales, outside of the inequities along racial lines that you've discussed here today, are there any other noteworthy gaps in vaccination rates along other demographic lines, whether that's age, gender, geography? Can you talk about that?
Dr. Gales?
Sure. Thank you, Rebecca, for the question. I'll try, and we can probably follow up with more specific details to answer that question. I mean, when we look at the breakdown of vaccines that have been distributed so far, we still do continue to see some disparities by geographic location. And I don't have our pulse report in front of us that we usually present on the council briefing, but we can share that information that looks at geographically the percentage of residents who've been vaccinated across the county. And we do continue to see it's that gap has closed for 65 and up, given that there was such an emphasis based upon age then. We do see some of the those same gaps that existed early on in the vaccine process exist for 16 to 64 now. And so a lot of the work to the earlier question about are we, celebrating right now, we're excited about the progress we've made, but we're going to have to take those very same lessons that we learned and tools that we use to close that gap for the older population for the group, the 16 to 64 now, to close that gap even more, to lessen the differences by geography and the county. Unfortunately, it does seem to, particularly for the younger groups, it does seem that some of those differences in terms of percentages of those vaccinated do mirror in some ways the priority zip codes that have been hit hardest. And that, again, underscores the extensive effort that we have and the attention that we placed on those zip codes to get a little bit extra consideration in terms of those dose allocations. We have seen, at least locally, more women getting the vaccine than men. And I don't know what that is necessarily about, but we do see some gender differences there. I wouldn't call it a gap per se, but we do have a higher percentage of female residents getting vaccinated compared to men. And we do, as we've talked about, we are starting, even though we're seeing the gaps closed by race and ethnicity, we still see those numbers there. The hope is that as prioritization expands to include all age groups, that the gap between younger residents will also decrease with older residents. And that's important because right now there is a higher percentage, younger groups are making up a higher percentage of those new cases because they've not had access to the vaccine compared to the older groups, which we saw at the earlier stages of the pandemic.
Got it. And a quick follow-up question just for those from the Minority Health Initiative, talking about that, small gap between men and women. Are you seeing that? How does that cross-reference to the racial data? So within specific racial groups, are you seeing gaps between men and women getting vaccinated?
Hi, how are you? We are not reporting as for now gender differences with getting vaccinated. However, we have seen much less engagement with our social media and our materials in general from men. So we have just hosted some focus groups with men to try to understand what their needs were. And we are making some adjustment to our communication strategy to be able to reach them too. And hopefully that will turn out for them being more interested in participating in the vaccinations.
Likewise, within the HAP effort, we're not particularly tracking that. But we do know that women tend to be the major influencer in health-related matters, and so much of the outreach and engagement and messaging really speaks to getting that loved one to sign up, encouraging them to go see their doctor, getting on board with some of the healthy practices that need to be maintained. So, yes, there's a steady flow of everyone coming in, but we know that at times part of the messaging has to speak directly to women in order to bring along the men in their lives.
Thank you. Rebecca, if you have more questions, please do follow up with us at the Office of Public Information. Hopefully this answered your questions. We do have a hard stop right now at 1:20. Unfortunately, we need to transition to other programming. This presentation, of course, will be published on our YouTube channel shortly after we say good afternoon. Thank you, everybody, for joining us today, reporters and presenters. Stay safe, and we'll see you again soon. Thank you.
Thank you all.